I'm peer with a lot of amazing people who are learning to and know how to use their voice to affect change, because we represent people who often feel voiceless. And as a nonprofit executive, I think we have a sacred trust and responsibility to stand forward and to really be a voice and an advocate for the people we serve. Because if we don't, right, who will?
And, no one else will, right?
Yeah. And I'll just kind of say it. White men, we need to stand up and, and be a voice in this.
You're listening to the Nonprofit Counsel podcast with host May Harris.
Welcome to the Nonprofit Counsel podcast. I'm May Harris, and today joining me is John Van Cleef, the CEO of CRC, a nonprofit organization, I believe, located in North County, San Diego. Welcome to the show, John.
Thank you, May. It's nice to be here with you and to be able to share in this setting with you.
Yeah, so maybe we can start by you sharing a little bit about your experience as a nonprofit CEO, how you kind of got into the sector, what brought you here. So tell us all about that.
Well, it's a long story that really started with birth. I was born into a family that was generationally involved with a faith-based service agency, and so I grew up in a home where faith and service were just what you did, and it was an expression of our values. And so as I grew, right, went through my young adult years, and I spent time in the military. I was a military policeman, and I realized that in those settings, even being, kind to people and working people when you're, law enforcement, showing up somewhere, I realized I wanted to be further upstream in connecting with people along the way. And so my path out of the military, my family was involved with the Salvation Army, so that was the path I knew and understood. And so I spent over 20 years with the Salvation Army in a variety of leadership roles, and found a lot of joy in that experience. Over time, my desire to be rooted in a community and connected to a community-based organization that was, nimble and, adaptive and quick-moving, really kind of, stuck to me. And so went through, a bit of change, and then those changes led me to where I am today at CRC. And so really, really pleased with the journey I had, all the things I learned, the time away from the sector a bit. I worked at Palomar Health for several years, but stepping back into the human service sector, where we're really addressing critical, essential human needs for our neighbors. And it's kind of how I'm knit together to do this work. Yeah.
So tell me a little bit more about CRC. What is it that you do? You mentioned, basic human, needs. What is it that CRC does?
Sure. CRC was established in coastal North County in Encinitas, first off in 1979. We talk about our vision is communities where everyone has access to the resources they need to live with dignity. And if you just boiled it down to one word, it's like, our vision is dignity. And then through the services we provide, we talk about our mission being to help our neighbors create paths to healthy food, stable homes, and safe relationships. And within those three kind of umbrellas of our mission, we have a safety net of services that address food and housing security. And then connected with that, a series of services that support survivors of abuse, so child abuse, domestic violence, elder abuse, And then in the past several years, kind of, I would say it's really foundational underneath those three umbrellas is behavioral health, making sure that the services we provide are trauma informed, that they're aligned with helping people really with their needs, so that in the delivery of food from our pantry, we're also informed about how the experience in the environment can be also a part of their pathway to whole health. Yeah.
Wow. So how many individuals are you currently serving? How big of an impact in the community is CRC? It sounds pretty amazing.
It really is. And it's a great question, because people often think, oh, coastal North County, San Diego, there's not much need there. But, but we've seen an increase of people served since and through the pandemic. So we're, if I get it right, I'll undersell it, about 7,600 individuals a year. And that number is greater. And so through a variety of our programs, but also one thing I forgot, we do prevention education. So we're working in high schools with junior high and senior high schools about healthy relationships. So whether it's dating or not, young people can learn about healthy relationships, pay attention to red flags, and instances that could lead to trauma in their lives.
Well, hearing you speak, it just occurred to me. I mean, you mentioned it. You're coastal San Diego County, North Coastal San Diego County, which, at least the perception is that you have high net worth individuals, it's a very nice suburban area. And then, but you are seeing an increase in the needs for social services needs in your community. How do you kind of, bridge that communication gap when, most people have a perception that, oh, you guys don't need our help, but you actually do. How do you bridge that?
I think that becomes bridging that gap, I think is a good thing that we were kind of started in North Coastal San Diego County by community members who saw and understood there were needs in the community. And so that, because we're a local nonprofit and not like a national organization that's come into the community, we have that identity and connectivity with the values and the expression of compassion from our neighbors. I often describe, coastal North County as communities that have the capacity for giving and the compassion for giving, right? And CRC is really the child of those two things that's been brought about. So that helps us. And then, there's a constant conversation around introducing people to the face of need. And oftentimes, they're surprised to discover, which neighbors they have are in need, right? One of our board members talks about how when her nieces were at Santa Fe Christian, she discovered there were food insecure kids in the class. And you would think at Santa Fe Christian, really kind of an unheard of it, private school. And so there are those stories. There are stories of multi-generational Latino families who've lived in coastal North County, right? Who have been affected by job, change, who've been affected by, medical bills. And so those kind of stories as well. Increasingly, what we're seeing is middle income seniors. The age wave is a real thing, and inflation is a real thing. And even though the market's been performing well, how inflation has outpaced the growth and what they can draw on for things like groceries and gas. And then you have a lot of our middle income seniors, they've lived in their homes since the 60s and 70s. And so now it's like the repairs, right, on homes, and being able to keep up with that, plus groceries, plus insurance, plus. And so we're seeing more and more middle income seniors.
So how are you addressing that at CRC, and what kind of guidance or advice could you give to other organizations or executive directors who are facing the same thing that you are?
Oh, that's a big question these days. I think the baseline answer, and kind of knit within my own character, is determined perseverance. I think these days required that kind of consistent perseverance in doing what we know is good, and it's tiring. But doing good and doing the right thing will always be met with the right resources, and so that has been key for my own self in this. I think understanding to my colleagues, I would say, understand your data, understand your need, right? Be able to quantify that, because, it's important to be able to tell the whole story of what we're seeing. And while we do that, right, telling personal stories continues to matter. And the key is that personal story is representative of the many, many stories of the people that we're helping along the way. And finally, I would direct people toward caring for their teams. My coach, I was talking with her about the season and everything that was going on, and she introduced me to a word that was it helped me see things differently. It's called polycrisis, right? It's not individual crises that are happening. It's one giant crisis with a lot of streams flowing into the river. And it's really quite overwhelming. And to take that in, and then to realize that the people we serve are living through trauma and uncertainty, and our staff who are providing direct service are helping people live through that while they're also experiencing that. And so one of my focuses, one of my foci, probably my key, has been around the idea and subject of psychological safety. Can't control all of these things that are happening in the world. And we're determined and we're dedicated to coming to this place where we help other people navigate these crises. So how can I, as an executive leader, create and work with my team to create an environment where we're able to focus on the work, right? Acknowledge the challenges, acknowledge there are things we don't know, and create safety in our focus on serving others, how we adapt to the changes, how we express ourselves through that, and maintain our commitment to each other. Creating a workplace that is as free of chaos, right, as possible, and that's as focused and aligned and committed to each other and our mission as possible. That's been a big place where I've been paying attention since the start of the year.
That's a great theme. In order to empower your team to serve others, you really have to feed their spirits, feed why they're there, and recognize that, especially in the community that you're serving, you're right. There's trauma, there's chaos, there's a lot of difficulties, obstacles, and what might seem somewhat hopeless. And your staff and your volunteers, I'm assuming you have volunteers, are internalizing that and experiencing that at the same time. So just bringing that to consciousness and serving them, and that is quite powerful, I think.
Yeah, well, it's been like, for example, we had an all staff meeting a month and a half ago, and one of our board members, his wife does sound baths, And so for the last hour of our all staff meeting day, people had the option to attend that. Or my only request was, you are on the clock. So please go do something for an hour. If you're not doing this, go do something to care for yourself. And so I would say about a third of the staff stayed for the sound bath and the sound. And it was fantastic. And I did warn the people next to me that I would snore, right? And, to give me an elbow, which they did. But just, even taking time out of, the work time and creating those moments to say, hey, here's a self-care opportunity, on us kind of thing. Take the time. And so,
well, that's recognizing, right? So it's sharing with them that you're recognizing that this is difficult, that it can cause angst and chaos and everything in their life, and saying, I see you, is incredibly powerful. Very cool. Very cool. So tell me just a little bit more about what you're experiencing now. So are you federally funded a lot, or are you funded through private donations?
Yes. We have a pretty balanced portfolio of revenue. Well,
that's nice to hear. That's exactly what you want to have
it really is.
In a situation like now.
Yeah. And so about 55% of our funding is government. And then 28% of that 55 is federal. Then about 30% is private funding. And then we also operate resale stores, and that's about 15%. And so as we monitor, what's happening with the federal government, and as we're seeing it through the OBBBA, right, and understanding, its impact on, key place it's affecting is SNAP, and then CalFresh, and then now with the appropriations budget, and, even though it's on hold, really clear impact to continuum of care funding, which supports people who are in permanent supportive housing, right? Rapid rehousing. So, having people placed. And so we're really monitoring that with concern because it could create, a whole new wave of unhoused people. And so it's exhausting.
Yes.
Yeah.
But, I do think that there's power. I was speaking to another guest on the podcast the other day, and, recognizing the obstacles that are coming at you. Yeah. You can see them. You can plan for them. You can pivot as necessary, and look at some of those as opportunities to move in a different direction. And if there is any iota of a silver lining on what's going on right now, it's that I do think there is attention on nonprofits now, which is a good thing. But also the ability to say, okay, to donors, to private foundations, to community members, community foundations, we really do need you to step up in this situation.
Yeah. And to remember that the power of advocacy, and like you were sharing, in many forms, stays. I know in the San Diego County area and community, the San Diego Foundation, the Prebis Foundation, and the Price Philanthropies have recently stood forward to announce, a fund to support nonprofits through these times. Advocacy with the state of California has been positive because the state is being very proactive to protect these services in the midst of these changes. And then I just received an email right before this, part of a consortium of domestic violence service providers in the state of California. And I didn't retain all of it, but the public policy advocacy at the federal level is working still. Protections for survivors of domestic violence who have, unclear documentation status have been protected now. So the federal government stood down from that because the states were saying these are people who need protection, and so that was a huge kind of moment. So advocacy, whether with our local leaders, our government leaders, with our funders, is very powerful and effective. We've not lost our voice, and we need to still use our voice.
I think that's a perfect statement. So many nonprofit organizations don't realize they really have a voice, and they don't utilize the advocacy, their ability to conduct advocacy and lobbying. Most nonprofits are like, we can't do that. We can't. Absolutely, you can. Not only that, you should. The people that you serve in many ways are without a voice. So if not you, then who as an organization? You need to be the one that really amplifies their collective voice. So what would you're saying it's working. So what are some of the things that you're seeing that are working, like banding together organizations of focus and purpose? What are you seeing that's working?
Well, on the national level, right, there are great national coalitions who represent voices across all of the country, right? Because what we're seeing and what we know is the funding challenges we're facing are agnostic to political, party and the politics and the color of the state, red or blue, where I live, right? And so the National Alliance to End Homelessness, the National Domestic Violence Alliance, right? There's a Food Action Network, right? So these larger voices that represent the local nonprofits and state level, they're having an effect. So participating there, and then to your point, right? We cannot endorse candidates for office, right? We're not doing that. What we're doing is informing our elected leaders with information that they need to know so that they can make good decisions based on the policy and the information in front of them. And so I had a good friend of mine, she taught me, right, there are times to write in, right? There are times to lead or speak up, and then there are times to lead. And so for a lot of us as a community-based nonprofit, this is a great time to write in, right? Mm-hmm. This is a great time.
At minimum, you should be writing in.
Yeah, this is a great time to speak up and where I can and where it's right within my sphere of influence to lead, and to use, right? I'm peer with a lot of amazing people who are learning to and know how to use their voice to affect change, because you shared earlier, we represent people who often feel voiceless. And as a nonprofit executive, I think we have a sacred trust and responsibility to stand forward and to really be a voice and an advocate for the people we serve. Because if we don't, right, who will? And
no one else will.
Yeah.
Right.
And I'll just kind of say it. White men, we need to stand up and, and be a voice in this. And all we have to do is talk about the difference, good policy, good funding, the advocacy that the people we serve need, right? And to use our voice and all of our platform to affect that kind of change in our world.
Well, I couldn't say it better, but I thank you for saying it. We all need to work together and really step up. And the nonprofit organizations that are listening to this, the founders, the board members, don't think that you get to sit this one out. We're all in this together.
Yeah. And yeah, again, it's working, right? It is working. And it's important for us to share that and to know that we can.
Absolutely. Well, thank you so much for joining us. Before we sign off, are there any final words or guidance that you would like to offer? Because that's a great way to end it, but man, it probably isn't the last thing you want to say.
I think around through these times and, through the different voices and the different stories along the way. And I was in a moment earlier, and, of course, my mom's voice is one of the great voices in my head. She and I'm the youngest of three, and my sister's the eldest. So it's, often runs between my mom and my sister, who are the voices in my head. But when I was a teenager, I might have gotten in trouble a little bit along the way and been up to mischief. And oftentimes before I'd leave the house, especially when I was a teenager, my mom would say to me, "Remember who you are and whose you are." And that ruined a lot of, great opportunities for fun as a teenager. But as an adult, right? And, this sense of value and identity, right? Those words stick even today, for good, right? Which was her point all along. And so as we navigate these times, as we find courage, in each other's company and support with each other, as we, face the unknown, all of us have this value point within us that has brought us into this realm and dimension of service. And so, with thanks to my mom, I'd share with all of my colleagues, just remember who you are and whose you are, and we will be well.
I couldn't agree more. Well, thank you so much, John, for being on the Nonprofit Counsel podcast. It was a real pleasure speaking with you.
Likewise. Thank you.
Thank you for listening to the Nonprofit Counsel podcast. Are you ready to lead with clarity and confidence? Head to nonprofitcounsel.com to find the tools you need to start smart, lead strong, and create lasting impact.